Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
So, um, what if a seemingly insurmountable childhood illness suddenly had a glimmer of hope? Imagine newborns facing this really devastating genetic condition where, until recently, the outlook was just bleak.
Yeah.
But now, a medical breakthrough is offering a real chance, not just at survival, but maybe a better quality of life, too. That's exactly what we're diving deep into today.
Right. We're exploring Molybdenum Cofactor Deficiency Type A. This is an exceptionally rare metabolic disorder. It strikes newborns. The estimates are somewhere around like 1 in 200,000 to maybe 1 in 500,000 births.
Wow.
Really rare.
Okay, molybdenum cofactor deficiency type A. That does sound very scientific. Can you break that down a bit? What's actually happening inside these infants?
Well, essentially, it's a genetic problem. A fault, in their genes prevents their bodies from making something called molybdenum cofactor.
Molybdenum cofactor. Okay.
And this cofactor is vital. Several crucial enzymes in the body need it to work correctly. Without it, these enzymes just can't do their jobs.
Right.
And that leads to this dangerous buildup of toxic substances that, well, they rapidly cause irreversible brain damage. Sadly, the usual outcome historically has been death during childhood.
Wow.
Think of metabolism maybe as the body's way of processing fuel and building blocks.
Okay.
In molybdenum cofactor deficiency type A, a really crucial part of that process is broken because of that faulty gene, leading to the buildup of these harmful substances.
That sounds truly devastating. But like you said, we mentioned a breakthrough at the start. There's been some exciting progress, right?
Absolutely. We're focusing today on a really significant clinical study. The findings have just recently been made public. Our sources for this are a health news article from the University of Cologne and also the detailed scientific paper itself published in the Journal of Inherited Metabolic Disease.
Right.
Both of them are highlighting these really encouraging results from this important research.
Okay, so as we dig into these sources, what's our main goal here? What should our listeners really take away by the end of this discussion?
Well, our aim is to thoroughly understand this promising new therapy. We want to explore how it works, what the clinical study actually revealed about its effectiveness for these newborns with molybdenum cofactor deficiency type A, and maybe touch on the wider implications for treating other rare diseases too.
Great. Let's get straight to the core then, this clinical study. What was the objective? What were the researchers hoping to achieve?
So the main purpose was to assess how well a drug called Fosdenopterin, it's also known as recombinant cyclic perinopterin monophosphate, bit of a mouthful.
Quite a name.
Right. How well it could improve the chances of survival and also support the developmental progress of infants diagnosed with MoCD Type A. It's really important to remember that until this, the available treatments could only really manage the symptoms. They couldn't tackle the underlying cause.
And given this condition is so incredibly rare, how did they even manage to study it? I mean, running a big trial must be almost impossible.
You're absolutely right. The rarity makes conducting a standard large-scale controlled trial extremely difficult. So what the researchers did was adopt a different strategy. They compared the outcomes of 14 patients who got the Fosdenopterin treatment.
Okay, 14 treated.
With a group of 37 patients who didn't receive the treatment. These untreated patients were part of what's called a natural history study. Basically, it just observes how a disease progresses without specific interventions. The data they analyzed had a cutoff date of October 31st, 2020. So yeah, because they didn't have like a directly comparable group getting a placebo at the exact same time, we do have to be a bit cautious about drawing absolute conclusions, maybe.
Okay, that makes sense. So comparing these two groups, how was the Fosdenopterin actually given to the treated patients?
The Fosdenopterin, or that recombinant cyclic perinopterin monophosphate, was given intravenously, so into a vein every single day.
Daily.
Yeah, daily. This meant the patients needed long-term central catheters. Those are lines inserted into a large vein. The study actually pooled data from 3 separate studies, and each had slightly different ways of figuring out the dosage. They were called MCD 501, MCD 201, and MCD 202.
Wow, okay.
While the exact amounts per kilogram might have varied a bit between them, the basic approach was the same: daily IV administration.
Got it. And how did the researchers analyze all this data to figure out if the treatment was, actually making a difference for these babies?
They used several sophisticated statistical methods. To look at survival rates, they use something called Kaplan-Meier methods and a Cox proportional hazards model.
Okay.
Essentially, it's a way for researchers to track how long patients in both groups lived and see if there's a statistically significant difference over time.
Right.
For development, they use the Bayley scales of infant and toddler development. These are standardized tests that evaluate motor skills, cognitive skills in young kids. And they also measured specific substances in the urine sulfocysteine, xanthine, and uric acid, and compared how these levels changed in the treated versus the untreated kids. These substances are really important indicators related to the metabolic problems caused by MoCD Type A.
Ah, so those are the biomarkers you mentioned earlier.
Exactly. Think of it like this. When the body can't process that molybdenum cofactor properly, these specific chemicals build up in the urine, acting almost like a red flag for the disorder.
Right, okay. So what were the actual findings? What were the really important results from this study?
Well, the results were truly encouraging. Firstly, and this is really significant, the patients who received the treatment had a much lower risk of premature or early death.
How much lower?
The hazard ratio they calculated was 5.1, and the p-value was 0.01, which statistically strongly suggests a real difference.
Wow, 5.1.
Yeah. To put it maybe more plainly, the risk of death was about 5 times higher in the group that didn't get Fosdenopterin compared to those who did.
5 times. That's
Yeah.
huge.
It is. And interestingly, the median overall survival, that's the point where half the patients are still alive. It wasn't even reached in the treated group by the time they analyzed the data.
So they were mostly still alive.
Exactly. In contrast, the median survival for the untreated patients was around 50.7 months.
Just over 4 years, compared to potentially much longer. That's a really substantial difference in how long these children lived. What about those biomarkers they were tracking? Did the treatment affect those?
Yes, absolutely. The treatment led to a rapid and sustained decrease in the levels of those key urinary biomarkers, S-sulfocysteine and xanthine.
Rapid and sustained, okay.
Yeah, they saw a remarkable 94% reduction in S-sulfocysteine and a 92% reduction in xanthine in the treated patients. It brought their levels much closer to what you'd consider normal.
94 and 92%, wow.
Right. Whereas in the patients who didn't get the treatment, those levels just stayed abnormally high throughout the study. Urinary uric acid levels also normalized in the treated group, while they tended to stay low or even undetectable in the untreated group.
So it's really fixing that underlying biochemical problem.
It seems to be addressing it directly, yeah. You can think of it like this. The buildup of these toxic substances is like constantly poisoning the brain. Now, Fosdenopterin can't undo damage that's already there.
Right.
But it dramatically reduces this ongoing poisoning, which allows the brain a much better chance to develop than it otherwise would have had.
That makes sense. And what about developmental milestones? I mean, it's not just about survival, but how are these children actually able to grow and develop?
Absolutely critical point. And here, too, the results were positive. At 12 months of age, a significant percentage of the treated patients were hitting important developmental milestones. 43% could sit up without any help.
Great.
44% were able to walk.
Walk. That's amazing.
Yeah. And 57% could feed themselves orally. These were all really notable improvements compared to the untreated patients. And the treated group also had a much longer median time before they needed to rely on feeding tubes, something like 75 months compared to just 10.5 months in the untreated group.
That is incredible. Being able to eat by mouth, that makes such a huge difference for the child, for the family, everything.
Totally. It's a massive quality of life factor.
Were there other ways they looked at motor function?
Yes. They use something called the Gross Motor Function Classification System, which basically categorizes different levels of mobility. At their last assessment in the study, 44% of the treated patients were classified as level I. That means they could walk without any aids or limitations.
44% walking normally.
Compared to only 9% in the untreated group reaching that level.
Big difference. What about seizures? Those are often a really major challenge with this condition, right?
They are. Seizures were common in both groups, which is, unfortunately, typical for molybdenum cofactor deficiency type A. While most patients in both the treated and untreated groups did experience seizures, the study didn't actually find a statistically significant difference in whether those seizures eventually stopped or were controlled versus just continuing.
Okay, so maybe less impact there, statistically speaking.
Yeah.
And what did the brain scans and neurological exams show? Any differences?
Unfortunately, in most patients, both treated and untreated, the brain scans showed abnormalities. And these didn't tend to change much over time, which probably reflects that early damage we talked about.
Right, the damage is done early.
Exactly. However, there was one treated patient who did show some improvement. Their neuroimaging findings shifted from being clinically significant down to not clinically significant. So a hint of potential improvement there.
One patient, okay.
And on the neurological exams, the treated patients generally had fewer abnormal findings, particularly things like muscle tone in their trunk and limbs, and their deep tendon reflexes seemed better.
It really sounds like starting the treatment as early as humanly possible could be critical. Did the study give any information about that timing?
Yes, it did. The researchers definitely observed that beginning treatment with Fosdenopterin within the first 14 days of birth seemed to lead to better outcomes.
2 weeks.
Yeah. A higher percentage of those infants treated really early were able to achieve oral feeding, walk, and sit independently compared to those who started treatment later on.
That time frame is just incredibly tight then. These findings sound like they could genuinely change the lives of families facing this diagnosis. What are the most important takeaways, the big picture implications?
Yeah, the significance for newborns diagnosed with Molybdenum Cofactor Deficiency Type A, it really can't be overstated. It represents a massive shift from a condition with a very high likelihood of early death and severe disability to one where improved survival and, importantly, meaningful developmental progress are now a real possibility. This just offers a tremendous amount of hope to families.
Absolutely.
Yeah.
And what does this mean for how we actually diagnose this condition?
Well, it really highlights the urgent need for early diagnosis, and it raises the potential, maybe the necessity, of incorporating MoCD Type A into newborn screening programs.
The heel prick test.
Potentially, yes. Currently, it's often not included in the standard tests done when a newborn has seizures, or even in routine newborn screening panels in many places. And this can lead to really significant delays in getting these infants the treatment they desperately need. This study really underscores how important it is to consider MoCD when a newborn presents with those early severe seizures, that epileptic encephalopathy picture.
So broadening the differential diagnosis right away, it sounds like every single day is crucial. Is there any potential to start treatment even before a baby is born?
Yes, the possibility of prenatal diagnosis is really significant here. If the condition can be identified before birth, through genetic testing perhaps, it opens the door to starting treatment even earlier. The study actually mentioned a really compelling case, a patient who was diagnosed prenatally and received Fosdenopterin within just 2 hours of being born.
2 hours.
Yeah. And this infant apparently showed remarkable progress, which just further emphasizes the huge benefit of incredibly early intervention.
That's amazing. And this drug, Fosdenopterin, it's actually been approved for use now, right? It's not just experimental anymore.
That's correct. Fosdenopterin has received approval from several major health agencies, the FDA in the U.S., the European Medicines Agency.
Okay.
It's the first therapy that has actually been shown to reduce the risk of premature or early death in patients with MoCD Type A.
That approval must have huge implications then for screening newborns. Are we likely to see MoCD added to routine tests now, do you think?
That's the hope and certainly the argument this data supports. The availability of an effective treatment dramatically changes the ethical and practical considerations around screening.
Right. This all sounds incredibly promising, but, as with any research, there are usually some limitations we need to talk about, right?
Yeah, absolutely. It's always important to have a balanced perspective and acknowledge the study's limitations. One is that the data for the treated patients came from 3 different studies, remember?
Yes, the MCD 501, 201, 202.
Right. And these studies might have had slightly different groups of patients, maybe different underlying severity, and they used somewhat different ways of figuring out the dosage. That pooling can introduce variability.
Okay.
Also, because the disease is just so incredibly rare, the number of treated patients in the study, 14, is relatively small.
True. 14 isn't a huge number.
No. And the group they compared the treated patients to those were patients who weren't part of a clinical trial for this drug, correct?
Right. The natural history study group.
Yes.
Yeah.
Using that type of comparison group, that historical control, it has inherent limitations. For instance, the patients weren't randomly assigned to get the drug or not. The researchers knew who was getting treatment, so there's no blinding. There could also be differences in how often and when the patients were assessed in the natural history study versus the treatment studies. And there's always the possibility of other unknown factors, confounders, that could have influenced the outcomes that the researchers weren't aware of or couldn't control for. The researchers themselves actually noted that within that untreated group, there were 4 patients who seemed to have a later onset of symptoms and lived longer than most.
Oh, okay.
And that could potentially skew the comparison a bit, maybe make the untreated group look slightly better overall than if those patients weren't included. So yes, the results are incredibly promising, but these limitations mean we need to interpret them with appropriate caution.
That's a really important point to keep in mind.
Yeah.
What did the lead researchers themselves have to say about these findings? Did they comment on the implications?
Yes, we have a quote from Professor Dr. Günther Schwartz, who led the international research team from the University of Cologne. He stated, "The results demonstrate that Fosdenopterin can significantly improve the outlook for infants with molybdenum cofactor deficiency type A. Our findings underscore the critical importance of research into rare metabolic diseases as it allows us to establish the groundwork for new treatment options and create better futures for these patients."
That really captures the hope this research offers, doesn't it? He also stressed how important it is to start treatment early, didn't he?
Yes, Professor Dr. Schwartz specifically highlighted the, quote, absolute necessity of initiating treatment as early as possible. He emphasized that the disease progresses very, very rapidly.
Right.
And he even suggested starting treatment in cases where MoCD Type A is only suspected but hasn't been definitively diagnosed yet because the window of opportunity is so small.
Wow, even on suspicion.
Yeah.
That shows the urgency.
Yeah.
So what's the main message here then? What should our listeners really be thinking about after hearing all this?
I think the key message is the pressing need for much greater awareness of molybdenum cofactor deficiency type A among clinicians, pediatricians, neonatologists, and the critical importance of timely testing to ensure that affected newborns can receive this potentially life-altering treatment as early as possible. Given its safety profile, the researchers even suggest that considering early empirical treatment with Fosdenopterin, meaning based on strong suspicion before confirmation, might be appropriate for infants showing those signs of brain dysfunction, that encephalopathy where MoCD Type A is a real possibility.
That sounds like a really proactive and potentially life-saving approach. Okay, as we wrap up this deep dive, what's one final thought you'd like to leave our listeners mulling over, something for them to really chew on?
Maybe consider the broader implications here. Think about this research for the many other rare genetic disorders that exist. How can the progress made in understanding and treating this one condition, MoCD Type A, serve as a model or maybe inspiration for tackling these other challenging conditions? What are the practical steps we as a society, as researchers, as clinicians can take to accelerate research and improve outcomes for all individuals and families affected by rare diseases? And perhaps, what are the ethical considerations around very early, maybe even presumptive intervention in these rare and severe conditions?
That's a powerful perspective, looking at how this breakthrough could ripple outwards. A great point to ponder.
So just to briefly summarize what we've covered, early treatment with Fosdenopterin offers really significant, genuine hope for newborns with the previously almost universally fatal molybdenum cofactor deficiency type A. It's been clearly shown to improve both their survival rates and their developmental progress.
And it really just underscores the vital importance of continuing to support research and raise awareness for these rare diseases, which often don't get the same level of attention or funding as more common conditions.
Absolutely. We really encourage you, our listener, if this has piqued your interest, to explore the sources we discussed today, that health news article from Cologne, the scientific paper in the Journal of Inherited Metabolic Disease, or maybe just learn more generally about rare metabolic disorders and the really crucial role of newborn screening programs. The more we all understand, the better we can support those affected and continue to drive progress in this incredibly critical area of medicine.
Thanks for tuning in to the Health Headliner podcast by Todo Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.